this presentation, we'll look into the background of this deadly disease, and learn why it's so deadly and should be stopped at all costs. The term AIDS stands for Acquired Immunodeficiency Syndrome, and is a deadly disease that attacks the body's most important defense mechanism, the immune system. AIDS is not a virus or bacteria, but instead describes the disease itself. AIDS is in fact caused by and a consequence of HIV left untreated. As stated previously, AIDS is caused by deadly viral disease that attacks the immune system and weakens it over time, so that the body is left defenseless when other infections enter, such as the common cold or the flu. The infection begins when the HIV virus enters the bloodstream and hijacks white blood cells called CD4 cells. These cells play an essential role in the body's defense system against disease in general. As the virus multiplies and spreads, more CD4 cells fall victim to infection and die. Consequently, fewer and fewer of these white blood cells remain in the immune system, and the body becomes so vulnerable that it begins to shut down, organ by organ. But before we go on to learn more about AIDS, let's begin with how AIDS comes into the picture in the first place. It all starts with one culprit, the HIV virus. HIV stands for Human Immunodeficiency Virus, which is the virus that causes HIV infection and illness. HIV attacks the body's immune system CD4 cells, which ward off infections, illness, and cancerous particles. Without treatment, HIV gradually destroys the immune system, causing health deterioration and the later onset of AIDS. HIV is transmitted through infected blood and fluids that originate from the genitals, such as semen and vaginal fluid. HIV is commonly spread through sexual intercourse and is therefore considered a STI. Another way it can be contracted is via shared needles or syringes. It can also be contracted through blood transmission from a blood donor in poor areas where blood screening of HIV isn't being performed. HIV can also be passed from mother to infant during pregnancy. Despite common myths, HIV is not spread through causal contact. That means that shaking hands, hugging, or even kissing someone with HIV will not cause transmission of the virus. Typically, people infected with HIV develop symptoms that closely resemble the flu within a couple of weeks after the virus enters the body. It is important to note, however, that some individuals do not show symptoms at all during this stage. Some of the symptoms include fever, headache, muscle and joint aches, rash, sore throat, painful mouth sores, swollen lymph glands, diarrhea, weight loss, cough, night sweats. These symptoms may be so mild that they go unnoticed. But in this initial stage of infection, the infected individual is more contagious than the following stages due to high amount of the virus in the body. In the next stage of HIV infection, the virus is still in the body and has also taken over the cells of the immune system, called the white blood cells. This stage has the potential of lasting many years for people who aren't receiving proper treatment. In this stage, the virus continues to multiply and destroy immune system cells. The infected individual may experience the same symptoms as previously mentioned in the initial infection stage, but may also experience other symptoms such as thrush, shingles, and pneumonia. So, how does HIV advance into AIDS? Advancement to AIDS occurs when the CDT cell count falls below 200 cells per cubic millimeter of blood. Individuals with a healthy CD4 count typically have between 500 to 1,600 cells per cubic millimeter of blood. In order for an individual to develop AIDS, it usually takes several years for the HIV virus to do enough damage in the body. Left untreated, HIV typically transforms into AIDS in 8 to 10 years. Once someone has AIDS, their immune system has been severely damaged. Because of this damage, infections that the body would normally be able to fight off become dangerous and even life-threatening. A name for these types of disease are called opportunistic infections. Some symptoms of these opportunistic infections are sweats, chills, recurring fever, constant diarrhea, swollen lymph glands, white spots of lesions on tongue or in mouth, constant fatigue, weakness, rapid weight loss, and skin rashes or bumps. Without HIV treatment and medicine, the remaining life expectancy of individuals with AIDS is around 3 years, and that expectancy falls to 1 year once infection of an opportunistic illness occurs. HIV treatment can still help people who have progressed to this stage, but the chances of survival are higher with earlier detection and treatment. Thanks to effective treatment, most people in the US do not get AIDS. This is because HIV can be treated with various antiviral medications. Antiretroviral therapy, or ART, which is a type of treatment that includes oral medicines and even monthly injections, is one of the most commonly used practices to help treat patients who have been diagnosed with the disease. ART has shown to be an effective method, as it prevents the virus from spreading in the body, and therefore reduces the overall viral load. Although ART cannot cure HIV, it helps infected patients to live long, healthy lives.